We hear about person-centered care all the time in the My Choice program. But what is it? The objectives of this lesson are to identify the principles of person-centered care, to list the attributes of person-centered care, to examine what prevents person-centered care, and to provide examples of person-centered care in the My Choice program. Person-centered care is defined as providing care that is respectful of needs and values cultural traditions, personal preferences and values, family situation, social circumstances, lifestyle, and needs, and ensures the person guides all decisions. Elements of person-centered care include the whole person care, coordination and communication, support and empowerment, ready access, and autonomy. Here's a checkpoint. What are the elements of person-centered care? Is it coordination and communication, support and empowerment, ready access, autonomy, or all of the above? The correct answer is all of the above. The overarching goal of person-centered care is health advocacy. Advocacy is part of the act of arguing in favor of something, such as a cause or idea. Health advocacy, which encompasses direct service to the individual or family member, while activities that promote health and access to health care in the community and the larger public. And healthcare advocate is a person, family member, caregiver, or clinician who supports and promotes the rights of the person that's receiving the health care. They focus on availability, safety, and quality of care. They use self-determination by providing and informing choice to guide person-centered care. And they help to build capacity in the setting, system, or policy, and always address the complexities of healthcare. The Institute of Healthcare Improvement, known as IHI, describes person-centered care in this way. It is putting the person at the heart of every decision. It is empowering the person to be genuine partners in their care. It is a conversation shift from what is the matter to what matters to you. It is a new way to make person-centered care effective that includes developing a person-centered service plan that is co-designed with the participant and their caregivers, ensuring that the participants' care preferences are understood and honored, collaborating as partners, designed to improve engagement, shared decision-making, and is compassionate, empathetic care. And it works to ensure that communities provide care for loved ones closer to home. Here's another checkpoint. Engagement extends beyond involvement of a person in their care from what's the matter to what is the matter to you and your family, what matters to your doctor, or what matters to you. The correct answer is what matters to you. Here are some practices conducive to person-centered care delivery from Harvard. So here's another checkpoint. True or false? Putting the person at the heart of every decision is a core principle of person-centered care. This is correct. The person is at the heart of every decision. Here are the principles of person-centered care. Respect for preference, coordination and integration, information and education, physical comfort, emotional support, involvement of family and friends, continuity and transitions, and finally, access to care. Each will be discussed. In person-centered care, respect for values, preferences, and needs is key. This includes being involved as a participant in the My Choice program in decision-making, recognized as an individual with unique needs and values, and also being treated with dignity, respect, and sensitivity to cultural values and autonomy. Coordination and integration of care within the person-centered care model means people express feeling vulnerable and powerless in the face of illness. If proper coordination of care occurs, then this can be alleviated. Areas in which care coordination can reduce feelings of vulnerability include coordination between the RN and social worker, or between the OT and the PT to coordinate frontline care in examples like with hospice. Information and education within person-centered care means the participant expresses their worries about not being completely informed about their condition or prognosis, and we try to eliminate those. To counter this type of fear, clinicians can focus on providing 3 types of communication: information on clinical status, progress and prognosis, and information on processes of care, and finally, information to facilitate autonomy, self-care, and health promotion. Each is important. Within person-centered care, physical comfort means the level of physical comfort people report has having an impact on their experience. Areas of particular importance are pain management, or assistance with activities and daily living needs, or the surroundings and the environment. Emotional support and alleviation of fear and anxiety are also important components of person-centered care. It means the following. Fear and anxiety are associated with illness, can be debilitating and have physical effects. Clinicians should pay attention to anxiety and depression regarding the physical status, treatment, and prognosis, the impact of the illness on the participant and their caregivers, and also the financial impact of the illness. Involvement of family and friends with person-centered care means the following. We're tuned to the family dimensions of care, which are involving family and close friends in caregiving and in decision-making, providing accommodations for families and friends, and supporting family members as caregivers, and recognizing the needs of the family and friends. Continuity and transitions with person-centered care means the following. Participants express concern about ability to care for themselves after discharge from a nursing home or a hospital visit, and how their needs are going to be met. So this requires the following. Understandable, detailed information regarding medications, physical limitations, and dietary needs. Coordinating and planning of ongoing treatment and services after discharge, and providing information regarding access to clinical, social, physical, and financial support on a continuing basis. And finally, access to care within person-centered care means the following. The participant needs to know they can access care when it's needed. Access to hospitals, clinics, and PCPs, availability of transportation, ease of scheduling appointments, availability appointments when needed, accessibility to specialist and specialty services when a referral is made, and clear instructions provided on when and how to get referrals. So here's another checkpoint. Which of the following is a person-centered care principle? Respect for preference, physical comfort and emotional support, involvement of friends and family, access to care, or all of the above? Of course, the answer to this one is all of the above. Respect, physical comfort and emotional support, involvement, and access to care. The person-centered approach includes respecting the uniqueness of the individual and creating an environment that promotes personal worth, social confidence, respect, truthfulness, independence, engagement, and hope. The person-centered care spirit and principles promote choice, purpose, and meaning in daily life, which means supports achieving the level of physical, mental, and psychosocial well-being that is individually practical. It honors the importance of keeping the person at the center of the care planning and decision-making. Care plans are living documents that are revised to reflect changing needs. This places a premium on active listening and observing so that the clinician can adapt to each person's changing needs. You're probably wondering, how does person-centered care benefit the participant in the My Choice program? They can achieve autonomy. They're able to direct their care and services. They have the ability to have choice, which fosters engagement. It improves quality of life, and it builds an environment of trust and respect. Here is the Center for Medicare and Medicaid Services Person-Centered Service Plan rule. Person-centered thinking helps establish the means for a person to live life how they and the people who care about them want. Person-centered service planning is a way to assist people in the waiver to describe what they want and need to bring purpose and meaning to their life. And person-centered practice is alignment of service resources that give people access to the full benefits of community living and assure they receive services in a way that helps them achieve their individual goals. The rules for designing a person-centered service plan include the following. The plan is driven by the individual participant, and it includes people chosen by the individual and is timely and at times and locations desired by the person. That's particularly true for personal care. And My Choice waiver site has to offer choice. The plan must also reflect cultural considerations and assist the participant and caregiver to achieve the desired outcome. Here's an explanation of the difference between the traditional medical model of care and a person-centered model of care, like capable. In other words, what is the difference? In the medical model, the person's role is passive, while in the person-centered care model, the person's role is active. In the medical model, the participant recipient of treatment is recipient of treatment and does not plan, while in person-centered care, the participant is the partner in the treatment plan and the care. In the medical model, clinicians dominate the conversation and do not act with the participant. While in person-centered care, clinicians collaborate with the participant, offer options, and discuss pros and cons. In the medical model, the care is disease-centered and often by condition with multiple physicians. While in the person-centered care model, there's the quality of life is the center, and it's focused on the desires and needs of the individual. In the medical model, the clinicians direct care and do most of the talking, while in person-centered care, clinicians listen more and talk less. In the medical model, the person may not adhere to the treatment regimen or plan, while in the person-centered care model, the person is more likely to adhere to the treatment and the regimen or plan. This sums up what the differences are. Here's a picture summary of a person-centered care, which is a visual depiction of the meeting. Person-centered care fosters optimal care by providing care that is centered and driven by the person receiving care, rather than by the clinicians or organization that is giving the care, which in turn empowers the person using person-centered care core values of choice, dignity, respect, self-determination, and purposeful living. Here's a case study of a real-life My Choice participant who received this evidence-based model of care during our pilot study. The person lived alone in the first-level apartment. They had a history of MS, anxiety, arthritis, depression, and hypertension, with caregivers who assisted with ADLs and IDLs daily, and had a knee replacement in 2008 and was bedridden since, and developed contractures in the legs, which made it painful to sit up. The participant had tried PT with little success. So the goal was to take a shower. The person reported they had not had a shower since 2008 and would love to sit under the water. Physical limitations had made it impossible to get into the shower, and even though the My Choice previously had used previous to the evidence-based model of care, no one had identified this as a goal of the participant. So the person-centered service plan focus area included shower transfer, chair transfer, and leisure activities. The details of the shower transfer goal included the RN and OT goal was the same. The long-term My Choice Supports Coordinator also wished to achieve this goal. The OT identified that purchasing a shower chair was out of question due to the limited income. So the MS Society and Foundation were both contacted to request assistance with purchasing a shower chair. After some time, the shower chair was obtained for the participant, and they were able to use a Hoyer lift to get into the shower. The participant overcame the anxiety of using the Hoyer lift and has been able to take showers 3 times a week ever since obtaining the shower chair. In regard to the chair transfer goal, in the beginning of the program, the hope was that the participant could increase sitting balance by initiating PT and then work on contractures. Unfortunately, when home health care was contacted, it was discovered that this had already been tried many times without success. So the RN and OT were notified by the participant that there was a Barton chair that was being donated and they thought it might be beneficial. So they obtained it and had it delivered to the participant. The chair is unique as it lies flat like a bed and the participant is able to slide on it like a gurney, using only one caregiver, and then able to sit up at a level that is comfortable. This accommodated the contractures and ensured comfort. This was the first time in 8 years the participant was able to get up, and now does so weekly for a few hours at a time, and continues to increase her endurance. The participant continues to get up and loves to be able to sit and get out of bed. In regard to leisure activities, there was an interest in finding more activities while in bed. So a black poster board was provided with puzzles, and the participant liked the strategy and was looking into bigger puzzle pieces because of the issue with grip strength. The participant was highly satisfied with the new evidence-based model of care and stated, "Y'all are so nice and know how to treat people." There were 2 life-changing moments while in the program: getting out of bed after so long and into the Barton chair so that she could have a shower after 8 years. The participant and caregiver stated, if it wasn't for the care team, nothing would have changed, and she still would have been in her bed for the rest of her life. In sum, person-centered, self-directed care is effective if focused on the desires of the participant. In the case provided, it was an example of how even though the individual had been cared for in My Choice for over 5 years, person-centered, self-directed approach truly made a difference. Thank you.